Lakini kumbe neno ukeketaji ni uharibifu ama uondoaji wa kiungo chochote katika sehemu yoyote ya mwili wa binadamu.
But the West, they believe the child born with the teeth will lead to the death of the child. But they are not correct, although they are not our top days. Actually, the first one is
infant oral mutilation. Now that is a cultural belief and a cultural practice. There are various factors, but what it does involve from an oral health perspective is that for a young child, maybe 9 months, 10 months, maybe it's a little bit older, but a really young child, that it's a cultural belief to remove the developing baby teeth or the bits that are developing still within the gum to either alleviate the child, to stop any disease or getting malaria.
We understood that there was a need to teach the local communities how to prevent oral diseases, and the belief that baby canine teeth are plastic teeth and needing to be removed.
Obviously it's a cultural belief, but what it often does for those parents or those communities, if that is the cultural belief in the area and you want to be part of that community and you're not willing to allow your child to have that done to them, then you're excluded from the community. So there's such that massive cultural pressure to basically have your child go through this infant oral mutilation. And of course you can imagine it's not done in any of the sterile conditions that procedure will be done in hospital.
With the diseases like malaria, pneumonia, infectious disease, but by not knowing this infection, that are the ones which causes fever, diarrhea, vomiting, removing the tooth buds of the canines. So actually, this has been a very harming cultural practice.
Often it's quite barbaric, it's incredibly invasive, and there is a high mortality rate that goes with that through sepsis and obviously the consequences of that of a young child.
So when we attended this infant oral mutilation program, and I was like shocked to hear those real stories from a mother. She took her child to the traditional healer. For the first child, they had this like a plastic teeth, and that was removed, but that child had a lot of bleeding, but it was okay. But the next child, she took it for uveitis, it's called chemo. When she had the chemo done for the second child, and that second child died actually, and that was very heartbreaking actually to listen to the real story of a mother. This program is well designed to give the awareness in the community. So we want other people from all over the place actually to come over here and to give this awareness. Infant oral mutilation is not the right thing because there's a lot of other treatments available for Udita, like tagging tie, uvulata, ischemio, and what changes we can do.
The mindset and the ethos around providing preventative education. Bridge2Aid is bringing training for teachers, community leaders, educators here, and really supporting the oral health message.
Straight away, I knew that the Ikigai team, to get all the educators together, I knew that we could come out here and give something
back, because I'm aware that I am in a privileged position at home. Education is power, so if I can come and spread a message to those who really need it.
I had no idea what to expect. I didn't know whether the children had toothbrushes, toothpaste. I really didn't know whether they would have any oral health education at all. It's eye-opening to come out here and experience that they do have toothbrushes and they do have some knowledge of oral health care, but when they want to learn and they want to be healthy. I suppose I was kind of taken back that they had quite a lot of knowledge already, which is fantastic that we can support and enhance that education.
During the program, we've had people ask questions from how to hold a toothbrush through to what acid is produced by the bacteria that metabolize sugars in your mouth. So that massive range, in my opinion, could never have been understood until I had got here.
I think if we consider non-communicable diseases and that oral health, there are 3.5 billion people in the world with oral health diseases. When I look at the pillars of lifestyle medicine, I can see the people in Tanzania tick all the boxes for all the pillars, but when we come to nutrition, I've been eating the most incredible food here that is all healthy, straight from the farm, no processed food. But the one thing is sugar. There are soda drinks absolutely everywhere and signs for soda drinks everywhere. I think sugar is definitely the problem here.
And they're asking such interesting questions that we potentially haven't been asked even back home in the UK. And some of the questions even stumped us a little bit, which is amazing. And they all want to learn, but we're realizing the adults, they are learning for themselves before they are learning to teach others. So we almost need to get over that hurdle of teaching the adults so that they can look after their own mouths before they then teach their children and their students and other members of the community.
You are helping with the IOM program. How have you found it so far, and do you feel like it's been successful?
Yes, I so much appreciate the program. It has been very well since last year when the program started in the Morogoro region. But in previous years, it started in Mara region, Kagera, and other regions. It is very successful, and I see it bringing more and more positive results in our Tanzanian community. The education which is given is very much valid, and our communities really need it in order to send the children and even adults to stop having these myths of, for example, plastic or nylon teeth and many others. So it is very successful, and I see that it is going to bring a very huge impact in our community.
Perfect, thank you. And do you feel like there's any pushback with the education? Do you find any of the community are against the message that we are bringing with IOM?
Change is a process, and it is sometimes difficult. But the way the education is given, the way the community is engaged, different age groups. We see here we have some religious leaders, we have traditional healers, and many others. So this one captures the community. So different groups are captured, and then the education is given from all corners of the population. So I see this is the good thing that this program has, because all key people are involved in the program. So even if there is the resistance or there is pushback, really it's not, I would say it is very minimal or not at all.
Yeah.
Because even school teachers are engaged.
Yeah.
We have healthcare workers are engaged, community healthcare workers are engaged,
Yeah.
and many others.
Perfect. And do you feel like with Bridge2Aid helping out alongside the IOM program, giving out the oral health advice and general lifestyle advice to the support workers, do you feel like that impacts the community as well?
The impact is very huge. It won't be fruitful to give just education on IOM. The good thing is that the program also captures some areas of oral health, but general health at large. So during sessions, people are educated on how to clean their teeth brushing, gadgets to use in toothbrushing, but also other non-communicable diseases, risk factors, and many others.
Yeah.
So it is very nice and it is a very good approach. I would like to urge Bridge2Aid to scale up to involve more regions, but also to have as many programs as these. As we have seen the impact, the awareness is huge nowadays. Things have changed. People have a different mindset. And you see, some people even are courageous to come in front and give their testimonies of what they underwent regarding IOM. That tells us that people really are educated, their awareness is raised, and people feel confident that what they underwent or what they did was not right for the good of people and health. And this shows that they are ready to change and they are ambassadors.
When I qualified, for the first kind of like 3-4 years was kind of generally happy just being a new dentist, you know, in my career. Because I'm a man of faith and a follower of Jesus, it's really important that whatever I do, that matches up to my values of who I am and who I follow. And so I had the opportunity very early on in my dental career to go overseas with an organization called Mercy Ships. And I did one of these trips. I walked into my first overseas clinic in Togo in West Africa. It just utterly blew me away. Kind of, there's little old me taking 2 weeks off, but literally because of those 2 weeks off, we were literally transforming lives, kind of like for forever, as it were. Now, part of that was a friend of mine invited me out to Tanzania. I've never been to Tanzania before. I've been to Kenya, been to the west coast of Africa. The invitation was to come to Tanzania to do some work with the church. There was nothing dental, nothing clinical at all. That journey was to go and see some missionaries. We get to this place called Bethany Orphanage. The woman missionary that came out from the hut office of this orphanage, she was stunningly beautiful, blew me away. I'm desperately trying not to give it away. But obviously this person that I met was Andy, who then became my wife. Engaged 1st of January 1996, overlooking Lake Victoria. Pretty romantic. But at that moment, we both felt God had a purpose and a calling for us to come back to Tanzania. Had no idea what it was going to look like, no clue. Obviously, Andy had been here for 2 years, working in the orphanage. I hadn't just fallen in love with her, I'd also fallen in love with the country. And in 2000, we had a phone call. A gentleman called Shiraz rings me up. I'm in Chichester, I'm in my office. And he says, got a proposition for you. How do you feel about coming out and building us a clinic in our dispensary? Now, I'd seen that dispensary, I knew what it looked like. That began the process of this could be that purpose, that calling to go. We started the conversation, and between that 2000 call and when we actually then left in 2002, that journey of going out, looking at the dispensary, looking to locate dental equipment to then set it up, going around dental shows. Hi, my name's Ian Wilson. I'm about to move out to Tanzania. Can you give me some dental kit? it just started to build this momentum. When we were working with the Aga Khan Health Foundation, clinic's going really well, lots of patients. I'm one of the few dentists for literally hundreds, if not a couple of thousand of kilometers. So people would fly in for Dar es Salaam, from Nairobi. And at that time, we were also talking with the Tanzanian Ministry of Health of how can we partner, how can we dovetail in, how can we complement what you're doing as a government in terms of serving the poor. They recognized that they had 80% of their population out in the rural areas. You had the qualified dentist, understandably so, working in the urban areas because you need to be able to work with those patients who can afford your fees. Only 15 to 20% of the population live in the urban areas. So you've got 80% of the population living in the remote areas that can't access simple pain relief. And you can be in pain for 2 months, 2 years. And the consequences of that, chronic pain, infection, things that just are debilitating for somebody living in a remote area. So the Tanzanian government working incredibly hard, working with partners to try and get what we used to call, or still call, oral urgent treatment. It's a package that came out of the WHO. We then recognised that because we wanted to be part of what the Tanzanian government were doing, both from an oral health perspective, but also social welfare, working with those of disabilities of various kind, but actually Aga Khan didn't really share the similar values, and it was clear that we were both going off in different directions. We looked for premises, we asked permission again from the Tanzanian government, and we then had the permission to build our own clinic, what was then called Hope Dental Centre. 2 surgery clinic with a little bit of a training facility. Again, amazing dental companies, you know who you are, the dental industry saying, well, we want to get behind this. How do we train, or how do we complement their wanting to train what they call a clinical officer to take urgent care, the oral urgent care, into rural areas? Could we run a smaller program using volunteers from the UK? We would go out to the rural areas, a training centre. Clinical officers would come to that training centre, that health dispensary. We would advertise it into the regional areas, patients to come and get pain relief and free treatment. We were having teams coming out to do training and development in an oral health perspective, transforming a community, and that was then what birthed what we called at the time DVP, or the Dental Volunteer Programme. And it just grew. It just grew. It captured the imagination of dentists, practices, dental corporates, and we would literally treat thousands of patients. Most importantly, take a tooth out of a person, you get them out of pain. Teach a Tanzanian rural clinical officer how to take the teeth out of their own people, you change a society. And that's what we were finding. So grateful to the teams that came out, so grateful to the profession that engaged with us, incredibly grateful to the Tanzanian government who gave us permission to do what we did. Sheena and Phil, Mark and Joe Topley, Graham. I mean, there are just scores of people just that were part of taking the organisation to another level. It wasn't just about me and Andy anymore. It was about all these people who had caught the vision and building it. It's just done a phenomenal job. And Chris and Annie Barrow, Colin Campbell, so many other people who have walked the journey with us. ADEC, Henry Shine, some of our trustees. There's so many people. People continue to walk with the organisation, but the trustees at a very, very difficult time held the organisation together in such a way. We're now in that place where, again, thankfully, under the invitation of the Tanzanian government, we are seen as their partners to support them for as much or as little as contribution as they want. And that's a real privilege.
Welcome Tanzania! So this is the first time that anyone that currently works with Bridge2Aid has been out to see Dr. Neela's IOM awareness campaign. And it's been incredibly powerful to see that and to sit in the room and to listen to everybody's stories. Because previously we've had videos from Neela and we've obviously had his written reports. But to be there and just see the difference that he's making and how people take that information on board, and just that realisation that traditional medicine isn't always the cure for everything, and that when it comes to children's lives sometimes being in danger, that the best option is for them to take them to a doctor and not always a traditional healer.
To change that mindset, you're changing the belief of a whole culture and society. And we've had the privilege of doing that, and we still continue to do that. And that is literally just impacting thousands of people where Neela has gone and had this message. Children no longer are having to go through this barbaric, invasive, and sometimes disastrous procedure.
Oral hygiene and dietary habits have such an influence in your life. That doesn't just mean cavities, tooth decay, gum disease. It has that overall systemic link as well to coronary heart disease, stroke, dementia. We've educated people about all of that.
The adults that we've educated as well. For example, just now, Robbie and I, we just had doctors and nurses, and they're, you know, we really upped the ante on the stuff that we educated them with, because we knew their knowledge base is going to be a lot more expanded than, for example, the teachers who don't know about all the bacteria and the volatile sulfur compounds and this, that and the other. So it's been a good wide variety of people that we've educated. Hopefully the infant oral mutilation is just going to be so much more reduced now that he's been raising this awareness.
The project began in 2022 with just a small area of 100 people. Now we are expanding. This last year and this year, we are covering a population of more than 10,000 that also reaches many school children.
The smiles on their faces and how happy they are, it completely brings you back to why we're here and who we're doing this for.
You know, we've gone to several different schools now. Every single time the kids have been so enthusiastic, and actually their knowledge has been quite good already, but it's just those final little tweaks, you know, to help them. They've talked about, you know, how they're going to tell their parents, their younger brothers and sisters, their aunties and uncles, you know, so hopefully even the kids can be, you know, like little mini ambassadors that are going to help us deliver the message.
It's a heart-touching experience, what we have achieved for the last few days. I'm very overwhelmed with this information I got from the community people. I would like that to take back and convey to my friends and colleagues so they can also take a step in future to come and help Bridge2Aid with this journey of good oral health. That will be the motto for all globally.
The Ikigai team have been phenomenal. I can't imagine what it would have been like if I hadn't have come for this first time with such an experienced team. These guys are all educators. They are going to help rewrite this programme so that Neela's got a much better focus about what needs to happen when we're out in the schools and when we're speaking to the adults like the teachers and like the community health workers, so that they can pass on those messages into their communities, and we get this cascade effect where if one person tells 6 people and then 6 people tell another 6 people, and before you know it these messages are out in the community. I'm really looking forward to see how we can make that work.
Interesting ways that they teach their children. They've got a lot of knowledge, a lot of information already, and so much more than I had expected. I also found it really quite difficult at times. You know, there are children that don't have shoes, there are teachers that don't have resources, there are classes that are absolutely packed full of kids, and you know, when we think about our children at home and the amazing education that they get, I really feel that, you know, these children are doing so well for the conditions that they're living in.
If you're considering to volunteer, to come out here,
do it.
And I think that the children have loved it as well.